Myanmar has a chronic resource shortage and poverty, as well as disparity in the country. So, of course, if you want to access family planning and other sexual and reproductive health services, financial barrier would be one key factor. The other thing is like physical or geographical barrier. Some places are still not receiving any kind of healthcare. Some parts along the border, and in some ethnic areas, some are really remote locations, would be relying on the local unqualified healthcare providers. Maybe they don't have enough money to pay as well. People generally are very conservative towards sexual and reproductive health.
We know that reproductive health and reproductive rights and a woman's ability to exercise autonomy in terms of the decisions she makes on sexual and reproductive health are absolutely critical to empowerment, to their ability to participate in society.
So Marie Stopes, when it established, I think people decided we have to be here for a long time, because there aren't that many people who are providing a full spectrum in a choice-oriented, human rights-based approach model. Marie Stopes' key service has always been family planning.
Marie Stopes operates in terms of a network of clinics and health centres. So through service provision, Marie Stopes is able to reflect and able to represent in many ways women's and young people's real concerns when it comes to issues of sexual and reproductive health and birth spacing in Myanmar. That's very important.
Traditionally, the unmet need has been estimated to have around 25-30%. So, those are stubborn pockets of unmet needs are remote, distant geographical areas of extreme poverty, which are not necessarily remote. You can just cross the river in downtown Yangon and get to one of the poorest locations in the whole country.
Marie Stopes is able to play a part not only in service delivery, which is very important in terms of trying to close that gap of unmet need and reaching people that may not feel so comfortable going to a government facility or may not be able to afford to go to a higher priced private sector facility.
Marie Stopes here, Nico when you are Bobby Dalia, Galito, Galito, let up there. We don't do a dinner now, and we are the Musina, didn't know Siamano. You are a Tida, or Siama, or Tida, a Contida, Galina Patata, being Gali and Nita, Balunida, a Contida. Movie Dale, Tazo to buy movie, Salis. Gemma and Savi Mwigri and Sai, anything, Gemma. Marie Stopes put Nina was a Dwana at saying Gontatare. Producer saying, does a Nyai quality. Second dollars go body with a focus like that.
Marie Stopes represents and stands for certain standards. That gives people confidence when they go to the clinics. And it means that women who are also poor are able to access contraception and services about maternal and child health, but also services for young people.
providing family planning and other related reproductive health services that can really, equalize the disparity between men and women.